Welcome to a lecture series on migraines, headaches, and headache treatment. I'm here with expert Suresh Kumar, MD, who is a triple board certified headache specialist and neurologist. He is also the director of the Headache, Traumatic Brain Injury, and Memory Research Institute. Dr. Kumar has dedicated his life to clinical research and the application in his daily practice to improve the life of his patients. Dr. Kumar has vast experience in treating migraines and has ran urgent headache clinics for over 10 years.
Hello to all the patients suffering from any type of headaches. I will try to make this lecture series as easy to understand as possible to help manage your headaches in daily life.
Dr. Kumar, how long have you been treating patients with headaches, and what kind of patients do you see in your daily practice?
I have been treating headaches for more than 10 years. I mostly take care of patients with headaches after concussion and post-traumatic brain injury. I can help patients with memory problem with injury and dementia.
And you're a headache and brain injury specialist. What makes you different from other physicians treating headaches?
As a specialist, I usually do not get many simple patients. Most of my patients have already tried over-the-counter medications, been to a primary care doctors, and have already been to one or two neurologists. They have already exhausted almost all the brain tests, may have already had a couple of MRIs. So I had to change my approach and start with them at the basics, meaning, remember, we all are 99% genetically the same and are born the same brain, same muscle and bones. It is our way of life, how we develop the epigenetics, or how we respond to a surrounding while growing up, that makes us different. My job is to sit down with you and defy these multiple causes or maladaptive behavior to your lifestyle. We do complete craniofacial exam. We also examine cervical spine, neck, head, nose, eyes. Posture also becomes a part of evaluation.
And why do people have headaches?
This is a very broad question. Now, to give a simple answer, there are different types of headaches. The most common tension headaches are caused by abnormal muscle tension around the head or the neck. Again, remember, there is no pain fiber inside your brain. Most of the pain we feel perceived from the cover inside the brain or outside muscles, blood vessels, and skin. These organs are supplied by nerve, and these nerves get irritated and send the signal to the brain for you to feel pain. The constant pain can also sensitize the brain, and then that becomes a chronic pain.
And how are headaches different in diagnosis and treatment?
We briefly talked about tension headaches, but let's talk about migraine headaches. We classify headaches in three broad categories: tension headache, migraine headache, and TAC, or trigeminal autonomic cephalgia like cluster headaches, which are mostly on the side of the head with autonomic symptoms of watery eye, running nose, and so on.
And what exactly are migraine headaches?
Again, migraine headaches are two kinds: classical migraine and common migraine. Classical migraine is a migraine associated with aura of blurry vision, flashing of light in mostly peripheral visions, called photopsia, or a tunnel vision, tingling of finger face on the same side, last 2 minutes to sometimes 30 minutes, followed by an intense throbbing or pulsating headache, light and sound sensitivity, nausea, or sometimes throwing up, may last 3 to 4 hours to all day. Migraine are mostly on one side comparatively. Common migraine do not have the aura of symptoms before beginning of the headache, and the mostly peak slower than a classic migraine headaches.
And Dr. Kumar, why do you have to know about a classical migraine?
Well, after nursing cooperative study and CDC recommendation, classical migraine is a risk factor for a stroke and heart attack early in age. According to the study, the classical migraine patient should also avoid early hormone therapy in their life during perimenopause or postmenopause. Classical migraine also have more defined triggers compared to the common migraines.
And what are the risk factors of a migraine?
Let's talk about the risk factor. Being a female is the risk factor. According to the Research Foundation, women are 3 times more likely to get migraine compared to the men. The peak age time of migraine is during menarche, during the menstrual period, menstrual cycle, and during pregnancy, or soon after the pregnancy, or perimenopausal period. Being female is tough.
Yes.
Do you know we have 30 million patients with the migraine? Almost 10% of the US population has migraine. 2 out of 10 female will have migraine headaches. 5 out of 10 will have a tension type of headache. So headaches are very common.
And what are some of the triggers of migraines?
I will discuss the most common one people ignore. Everyone knows about red wine, artificial sugar substitute, MSG or monosodium gluconate, chocolate, red dye in food or food additives. But common in my practice is drop in barometric pressure. We always get busy with many walk-ins when we have a rain front comes in. Usually it starts 4 to 6 hours before the rain, these headaches. Other common trigger is a sleep deprivation or excessive sleep or just before the menstrual cycle begins.
And Dr. Kumar, people say stress is a big trigger. How do you explain this?
I tell my patients, life is stressful, but the abnormal handling of the stress is the cause of headache, or it triggers headaches. Most of the headache triggered by a stress are tension type headaches, but these tension type headaches also can trigger migraine headaches.
And you mentioned that some people can sleep off headaches, but others can't. Why is that?
God has given us the best medicine. The best medicine is sleep. It takes care of all the problem we have during the day, makes us refreshed for the next day. If you are not waking up refreshed in your morning, that means your sleep is not working for you. This may also be triggered for headaches.
And why do some migraine headaches last 2 to 7 days or even longer?
A very good question. The same answer, your sleep, which is the best medicine, it's not working for you. You have to consult the doctor for a headache specialist to find out why your sleep is not working for you to help control these headaches. Or stress or anxiety is sometimes common if you don't sleep well. You may also notice that you do not have energy during the day when you have a sleep problem.
And why do people with headaches also have memory problems?
A new memory formation or memory retention and retrieval is a very complex, but a simple term is also directly related with your sleep and physical activity. Remember, a healthy body will have a healthy mind.
And what is the best treatment for migraine headaches?
This is my favorite quote. If the Einstein was a physician, he would have said, receiving same treatment from a different doctor with the expectation of a different result is stupidity. The best treatment is to find about you. You have already tried over-the-counter medications or prescription medications. So we hardly use the standard preventive medication routinely like beta blocker, topiramate, or amitriptyline. I do recommend that if you have migraine headaches, make sure that you have a rescue med which works for you. We have to treat your body, identify the craniofacial stress, evaluate your sleep, your emotion status, your body habit to develop the best plan for you. We also do a blood work and sometimes a more specific test to find out why you're having headaches.
And what health supplements or over-the-counter medications help with the migraine headaches?
I recommend health supplement daily in my practice. There are some good class 2 studies and class 1 studies supporting the use of supplement for migraine headaches. Vitamin B2, which is the riboflavin, is an excellent supplement if you take more than 200 milligram 2 times a day. Now, vitamin B12 and vitamin D deficiency in the body will also cause migraine headache. Butterbur magnesium supplement also prevent or decrease barometric pressure, trigger headaches. CoQ10 probiotics are helpful in excessive vomiting associated with the migraine headaches.
And Dr. Kumar, what advice do you have for hormonal headaches?
These headaches are usually hard to treat, but simple NSAID like ibuprofen or naproxen and magnesium are helpful in controlling the headache during the menstrual period.
And what role do narcotics or pain management have in treatment of migraines and other type of headaches?
I have treated more than 5,000 headache patients. I have not prescribed a single narcotics for headaches in past 10 years. There is no role of narcotic meds. It makes difficult to treat or control the headaches, as it is also one of the cause. Most of the migraine rescue med will not work with narcotics. Narcotic addiction and rebound headaches are big challenges in my practice and in the country. I always advise them, taper off the narcotic medication, come to my clinic, I will be able to help you.
And some of the patients who are taking the narcotics for back or neck pain and also having headaches, how can you help them?
As a brain injury specialist, I have been dealing with these patients' population, not only for the brain. When you have a brain injury, not only the brain goes through the trauma, but the person or the entire body goes through the trauma. I offer non-narcotic regenerative treatment for back pain, neck pain, shoulder pain. We have good success rate when they get off of the narcotics, and we are able to control their headaches, their back pain, and their neck pain.
And how does exercise help with headaches?
Exercise helps the same as preventive medication, is to change a neurochemical balance in your brain. It promotes the sleep habit. It's always in our plan to encourage the patient to do exercise if they have a constant or frequent migraine headaches or headaches.
And we hear about botulinum toxin, and how does botulinum help with headaches?
Deactivated botulinum toxin works by relaxing muscle, by inhibiting the chemical release in the muscle to contract the muscles. So people have realized that if you can relax the muscles around your neck, face, you are able to prevent the muscle spasm, and these spasms sometimes can irritate or trigger the nerve pain. It is best for the patient with both tension and migraine headaches. For classical migraine, we do not have a good success rate with botulinum toxin.
And what are other treatments for headaches that you offer?
We commonly offer treatments such as occipital nerve block or supraorbital nerve block, trigger points injection around the face and neck, TMJ treatment, as well as botulinum injections. Sphenopalatine block with the infiltration with the local anesthetic is another mode of treatment for the migraine headache. The 3 new preventive medications have been approved in last 3 months. These are another class of medication more specific for a pain receptor antibody like CGRP antibodies. Take once a month these shots, help to control your headache. They have been more than 50% success rate in these kind of treatment. The another kind of medication we also offer is sometime an IV ketamine therapy. They do help to desensitize the chronic migraine headaches which are not responding to medications.
And why do people with headaches come and see you or a headache specialist rather than a neurologist?
After listening some of our question and answer, you must have realized that we have to treat the person, not the headache. I take very limited new patients a day to take care of one life at a time. In headache patient, you treat a person, not a time. I control my practice in order to spend more time with each patient. I'm able to do so since I do not work for any corporate business and I'm not being pushed to see large number of patients.
And Dr. Kumar, my last question is, why do some people have headaches but not others?
According to me, as a headache specialist, there are two kinds of people in the world. One kind people I see in my practice who have headache, and the other kind people give headache.
Well, thank you for listening to our lecture series. If you have more questions,